think the smoking, smokers, this one, what we have started here, the clinic for smokers. This is because being in practice for almost 30 years now, what I found is when we were medical students, the incidence of COPD we used to see in a 60, 65, 70-year-old man. But now we are seeing COPD in the 30s. And COPD is a very, very crippling disease, which it is worse than having tuberculosis. At least tuberculosis you can take and get cured. This disease won't be cured, and the only cause is cigarette smoking. So what I saw is young children start smoking in school. By the time they are in their 30s, they become COPD, and then their entire life, the productive life, gets wasted. So with that idea in mind, we thought that we must start a smokers clinic here, where we can catch these people young, do the appropriate lung function for them, counsel them apart from medications, and somehow monitor them for every 3 months for 1 year, and somehow see that they can stop smoking. And we have been successful in this. Not that we have not been successful. It is not a 100% success, but we have achieved about 60 to 65% success in stopping smoking. There are enough number of studies published in the literature which shows that stopping smoking with medications like varenicline has come, and certain chewing gums have come, nicogums have come, and plus counseling by a psychiatrist, very important, because see, these patients are all right, they don't have any disease in the early stages, so they don't like to take medications. But proper counseling is important. That's why we brought in the psychiatrist and a respiratory therapist. And we have seen all over the world that this response is extremely good. Secondly, what we are also started here is called as Breathe Easy Clubs and Smokers Clubs. What we do is patients who are smokers, patients who are having asthma, COPD, they are invited once in 3 months, a small informal get-together where the patients themselves, they speak to each other how they solve their problems. This concept I saw because when I went to the ERS, European Respiratory Society conference, there one session is dedicated totally for the patients, by the patients. No doctor will speak there, patients will speak how they are able to tackle their chronic asthma or COPD. That's what I brought here. And we have done this initially in the I think 3 or 4 months. Our response has been very good. So that's why we wanted to promote this Breathe Easy program as well. Yes, our aim is to start this here in this hospital first, and then take it forward in the next 6 months or so, and then percolate it down to the district levels, because everybody can't come to the cities. So then percolate it down. We have got a dedicated team with us. There's one Dr. Divesh is sitting there. So we have got a dedicated team of pulmonologists. So we slowly want to educate the GPs on one side, because most of the patients, they go to their general practitioners. Once the GP is educated, he will take most of this one. They don't have to come all the way here. And then whatever we can offer as a specialist, we are prepared to offer here. Smokers clinic, I think they have to pay a very nominal fees because they involve some investigations. We do a lung function test, which is computerized PFT, X-ray, some blood tests, and ECG. These are done at a very, very discounted rate in the hospital, because it's only a screening tool. And once they are screened and diagnosed to have a COPD or smoking, then they are given the medications again at a discounted rate for 3 months each time. Then they are assessed every 3 months, and then we take it forward accordingly. My message is two things. As far as asthma is concerned, we must understand that asthma is a disease which is going to stay with us till our last day. We must know that asthma is basically an inflammatory disease, and the inhalers have to be taken. There are 2 types of inhalers again. One is a preventer, one is a reliever. The preventer inhaler has to be taken twice daily, continuously, till your lung functions improve, however good you may feel. The reliever inhaler is as and when required. Number 2, because what we see day-to-day practice is when you get an attack, patient will take medication and then stop it. But that's not going to help unless it takes the preventers. That's my first message. Take your preventers regularly. Number 2, as far as the smoking is concerned, it will be our endeavor every visit when the patient comes to us, we ask them, did you stop smoking? If not, yes, these 1, 2, 3, 4, these are points. Every visit, we as a pulmonologist, whatever time we can give, we tell them. This smokers group, what we call psychiatrists, other thing, they will be able to definitely help these children and young adults to stop smoking. So these are our two dreams which will come true.